Well, hey guys, welcome back to the channel. I'm Jeremy.
And I'm Mo.
And we're the Exploration Guys.
Yes, indeed.
Well, in our last episode, we welcomed our guest Jessica, who joined us to discuss her fear of flying, and she was able to answer many of our questions in what became an informative discussion about her anxiety triggers, as well as giving her tips to help overcome her fears. Now, to throw in another wrench into the works, we're in the middle of a pandemic. Many people have concerns about traveling and staying safe. And today we're going to talk about that. With me, I have Sondra. She's a Yale-educated PA, worked in ER medicine for 10 years. And Sondra, you've recently done some traveling.
I have.
Well, Sondra, welcome to the channel. It's great to have you here.
Thanks, Mo.
So let's kind of jump right into it. I think the burning question on everybody's mind, including mine, is how do I travel outside of the state, outside of the country? How do I do that safely in this world of a pandemic that we're in?
Well, I think there's a lot of steps that you can do to mitigate your chances of catching it. The CDC has a lot of guidelines. They also are talking about traveling specifically for a reason, not just, it's not time to go on vacation yet, but if you have to travel, there are certain steps you can do. Like for me personally, I try to choose the window seat because that cuts off, 25% of your close contacts. I, have certain systems in place. So like I'll bring a big baggie, a small baggie, some alcohol wipes, a pair of gloves. And when I get on the plane, what I do is I will put the gloves on. Even if they're saying it's washed or cleansed between flights, you never can be too clean. So I will take the alcohol wipe or some type of wet wipe that has an agent in it that can kill the virus. And I'll wipe specific things like the seat handles, the buckle for the seatbelt, the shade where the window comes down, the touch screen specifically. And then, I'll put it just to not make any airline attendants crazy. I will bring my own small bag to put all the junk in so you're not kind of throwing away alcohol wipes everywhere because that increases the time they need to clean between planes. And it's also dirty and gross. So then I'll take this and then I'll just have this at the end of the trip to throw away. I also clean the vent on the top, the air vent. And I actually take the vent and put it kind of towards me or facing in front of me. So it kind of creates a turbulence in the air. I read one article, it's not a scientific article, but any possibility.
What does it do? Does it help blow the air away?
Yeah, it's supposed to create turbulence in the air. You don't want to have it shooting towards you, but as what I've been told is that the air circulates from the top. It gets filtered and then it comes in through the top, then goes down towards your feet. Is that correct?
Yeah, typically in most airplanes, is the bleed air system from the engines comes in and does get pumped in through a filtration system, then up, flows in from above and then down, kind of cycles through. Some does get circulated through as well, but there are like HEPA filters in there. So the air is actually apparently pretty clean on board, it's my understanding.
Yeah, it's the same kind of filtration you have like in hospital systems.
Yeah.
Oh, wow.
So, I actually feel quite safe on an airplane. What you really have to worry about is, who's a couple rows in front of you, who's a couple rows behind you, and who's on the side of you. So if you can get that window seat, you're, in some flights, like I fly specifically JetBlue, I'm just brand loyal, but they're not booking the middle aisle or the middle row seat. So that decreases your chance of sitting really close to somebody. And, 2 flights I've been on, I didn't have anybody in the aisle seat. So I really only had somebody across the aisle from me and then in front of me and behind me. And then, you can do things like look at the app before boarding, if you have the app for seat assignments, and see if there's, 2 or 3 rows with nobody around you. And then that decreases your chance as well. JetBlue is now, I'm not sure if every airline is doing this, but JetBlue has taken away boarding groups and you board from the back to the front. So I like personally to sit in the front because if instead of boarding and kind of having all those people walk through, you board at the end and then you're leaving at the beginning, which is nice. I mean, not everybody can do that, but I try to pick the economy seat that's closest to the front.
Yeah.
So, I mean, just a few things like that. And then, when you're in the airport, instead of, sitting close to everybody, there's so many gates that they're not using now. I'll go and sit at a gate that's close by that nobody else is sitting at, so there's nobody around me.
How are the crowds when you were traveling?
Very different from state to state. I would say Boston, people seem to be taking it a little bit more seriously. In Logan specifically, people are maintaining social distance when you line up or when you queue up for the plane. The flight attendants or gate agents, I should say, are very specific about if people are clumping, they'll say, okay, now sit in your seat until you have to, until we call your row. In Fort Lauderdale, it's not like that at all.
No?
No, it's kind of like a little bit of a free-for-all at that airport.
Right.
And so you have to really be diligent about maintaining your social distance because other people don't seem to maintain that themselves. So you just have to be a little more careful. And I noticed in Fort Lauderdale Airport, there's a lot of people, a lot of food stalls are open where they weren't in Logan. Like the only choice is like Wahlburgers.
Oh yeah, of course.
And in Fort Lauderdale, there was a lot of places that were open, and a lot of people just kind of sit around in groups. And
that's interesting.
Yeah, it was definitely a different culture of what was acceptable and what wasn't. I mean, I noticed. And then in Massachusetts in general, I think people are just a little bit more cognizant of what the rules are or what we should be doing. It doesn't feel like that in Florida. I mean, even going to the grocery store in Florida, you have, people who don't seem to understand the 6 feet. I mean,
yeah.
Yeah. And all that.
Yeah.
Only in Florida, as they say.
Yeah.
Wild West.
Yeah. So it was very interesting about sort of the precautions that you take on board the aircraft. Especially, I never thought about the air vent and using that as sort of a barrier, almost to, if you had any virus or any type of airborne particles, to push that away from you. And that's really brilliant. So when you were on the aircraft, did you notice, did you have a mask on? Did you notice others that were donning a mask on board?
Yeah, and I personally don't take my mask off to eat. I can handle, 3 hours without eating or drinking. Some people may have to take a medicine or they can't. But for the most part, they hand out, instead of bringing you a snack, they hand out a little plastic baggie with a drink and a couple snacks in it, a small water. There's different types of masks. So, there's surgical masks, which you see a lot of people wearing. And then a lot of people have cloth masks, homemade masks. I didn't see a ton of N95 masks. Some people had them. Some people had like the black cloth mask that kind of comes around. Mm-hmm. There's debate still on, efficacy of, cloth masks versus N95 masks. And right now, N95 masks are really just used in, procedures where there's generating aerosolized particles or close contact with COVID patients. Now, there's been a lot of scientists that kind of debated with the WHO about talking about, is this aerosolized, is it not? And it's not really, is it yes or no? Is it either droplet or aerosolized? It's not a mutually exclusive kind of thing. It's a spectrum of how aerosolized the particles are. So I think that there's been a lot of studies in the past that show that simple surgical masks in hospital settings can protect you from things like flu and things that can be aerosolized. So, when I travel, I wear a surgical mask. I got these on Amazon. What's nice about these is that they all come in like a little plastic baggie, so you can just throw one in your bag. Because these are not to be used. The pet peeve I have is people think that they have this and then they could just, touch the outside, take it off, put it somewhere, put it back on. Like, it's supposed to be
one use only.
One use specifically. But I mean, there's different ways you can clean these masks, leave them out in the sun. I'm sure the CDC has different ways that you can kind of keep these clean. But, when you take it off, I'll just show you real quick.
Yeah,
It has a white side and a blue side.
Yeah.
Okay. So first of all, blue side out. And then white side in. And then you'll notice that right here is kind of bendy, and right here feels like it's more structured. The structured side goes on your nose. And when you're putting it on, once it's on like this, you don't want to touch the outside of your mask, because anything I touch with my hands and I touch the mask, you're introducing that into your face. So when you put your mask on, the most important thing is you have clean hands. And then you want it to kind of come under your chin, and then you want to pinch your nose down. So it's pinched on your nose. Like this doesn't constitute wearing a mask. Or this.
I was going to bring that up. I see people all the time that do not wear their mask or their face covering properly. And I'm so happy that you are demonstrating this, because you see that all the time. I even saw a guy with the mask like on the backside.
Wow. Yeah.
And then connected to his, I don't know what he was doing, but obviously that's not effective. And so I'm happy that you touched on that. So, pinching the bridge of the nose, making sure it's covering the nose, the nostrils, and the mouth, of course.
And when you take it off, try to, if you have hand sanitizer, sanitize your hands again. And then when you're taking it off, don't touch the mask. So don't take it off like this. Take it off with your hands on the outside, and don't touch the mask. And then you put it down in an area where you're not going to touch the area for a long time. So if I take it off, put it down on the seat next to me, that's no longer really a clean mask. Sterile techniques that we follow in medicine are not going to be upheld like the general public, but you can do little tiny things that can change the effectiveness of your mask. Most of it is hygiene, how you handle a mask and clean your hands and.
Right. Yeah, I must say, got the Purell going. That's great. I must say, even we find ourselves in August, and it seems to be difficult. Even if you wanted to get your hands on an N95, they seem to be difficult to get even here in August. So hopefully, those will be more readily available to the consumer if they wanted to pick them up. Although I do understand that the face covering and that the surgical mask that you've demonstrated is effective, and perhaps people don't really need to go out and buy up all of these N95 masks, and we'll save those for the medical community.
I think there's a myth too that these really aren't effective, and I think the biggest problem is using them properly to make them effective and to reduce your chances of catching the virus. But in the beginning, the CDC kind of came out, and we had a lot of discussions about this, about them saying that masks aren't effective. So when your government kind of tells you masks aren't effective and then changes their mind and say, okay, wait, masks are effective, people lose a little faith. However, they were doing it for a specific reason, because unfortunately we did not have enough N95 masks for the healthcare workers that did need them specifically to perform their job, so that they didn't get ill themselves. And I think instead of being honest and saying, hey, we don't have enough N95 masks, these will work, anything you have, any kind of cloth masks, they will prevent the spread. So start with that, and then we'll amp up production of N95 masks. Instead, they were a little bit, I don't know what the word is.
They weren't transparent.
Ambiguous.
Yeah, ambiguous. And I think later then they came out and then said, no, of course you should be wearing masks. And now the newest thing is eye protection. So we know the ways of entry are through your mucous membrane. So your mouth, your nose, and your eyes. And the amount of viral load you get can determine your illness burden. So, if you're standing right next to somebody and you don't have a mask on and they cough and you get a lot of viral particles in your mouth and you inhale it into your lungs and it goes deeper into your lungs, your body's going to react differently than if you randomly touched, a knob and had a couple viral particles on it and you rubbed your eye. Your body may react differently. So one person wearing a mask versus two people wearing a mask is a huge difference in control of the virus. So, it's true that if everybody just kind of put on a mask, we could kind of control this thing a little bit better than it is now.
It does. You were talking about how, like the amount of virus that gets to you and where that helps. Is it, so if you have open exposure, it's all coming at you.
Yeah.
But with a mask, it protects you, and maybe even if you do get a little bit, it's not gonna. It's better not to get a full heavy dose of it, right?
Yeah.
And that's what's happening with some of the medical practitioners, right? Is they're getting such large doses.
Yeah, and that was a lot of that was in the beginning too, when we weren't really sure how to kind of go about protecting employees with PPE. So I think as time has gone on, there's been a lot of protection for workers. Unfortunately, in some places, PPE is still in short supply. In some places, it isn't. But you know, the CDC is now recommending eye protection as well, because it can go into any mucous membrane, so it can go into your eye, and you can contract it that way. So you know, glasses, just regular glasses, don't really work because you have holes in all the areas. So
here goes our plan, Jeremy.
I mean, it's better than nothing, but you know, some kind of eye shield or goggles. I've seen people in ski masks.
Oh, really?
Yeah.
Yeah.
But you know,
A mask and a ski, like the ski mask whole thing. Then my goggles going into a bank.
Yeah. See, that
happened to me the other day.
I see people tying up their horses to buildings now with these handkerchiefs. It looks like they're going to rob the place.
Yeah, right.
Yeah, so I mean, if you're in an area where you can't physically social distance, like an airport or a grocery store, you know, eye covering and face covering is important, especially if you're somebody that is immunocompromised or has a risk factor, because that's important too. And then now CDC, I believe, well, Deborah Burke kind of talked about it. I'm not sure if the CDC has anything about this, about if you live with somebody who is immunocompromised or at risk of having a bad outcome, to actually wear a mask at home as well. So I'm not sure how many people are doing that now. But.
Well, I would guess not many, but PPE is definitely important in this, and I hope that people listen and that they don their PPE and do the right thing. But Jeremy, I have a question for you. I've been seeing a lot of renderings out there. Inside the aircraft, you have the row, you have 3 seats, and the middle seat is actually turned around to the aft. It's sort of an idea to protect and distance people from each other. Do you think that something like that could be coming and maybe in the pipes with some of the airlines?
You're contained in the same area. I think people sometimes have the best of intentions, but some of these, I've seen similar renderings and, you know, putting partitions between the seats. And you also have to remember these aircraft, you know, as a safety factor is, you know, obviously trying to minimize the exposure to an airborne virus, but also just for egress of an aircraft in an emergency. You know, if you're starting to put partitions between the seats, how are people going to escape quickly? If seats are backwards, well, how do people get into the escape rows and understand what's going on? Which way do they go? And you're trying to get the flow out as quickly as possible in an emergency.
Right.
And I think all those sorts of things would hinder that. And the seats just aren't designed that way. How do you do for just even in as a safety factor for, you know, if there is an impact of some sort? We wear seatbelts in airplanes. You know, you're designed to. How's that? The seats aren't designed to be for you to be backwards. You know, you tend to move forward. I mean, you do back up in an airplane, but you're really not moving very fast backwards in an aircraft.
And the person that's in the middle seat that's facing the row behind them, are they facing the people? Like,
yeah,
yeah,
it's funny, and it's the perception of, oh, this is the way it'll have to be. You know, I think we hope eventually we'll get a vaccine for this thing, and can get things back to normal. It's certainly affecting the industry in terms of travel for flying and anything, flying, cruise ships, I'm sure trains, and I've never as much. I know we have local tri-rail here in Miami. I believe that's still operating, but how many people are making use of that?
Yeah, a lot of people aren't really wanting to go on buses or trains or, you know, specific enclosed areas with strangers, even with masks on, just because it's, you know, prolonged exposure. And I don't even know, do they have HEPA filters, things like airplanes have on buses and trains?
I wouldn't think so.
Yeah, probably not.
Look that up, but I'm not sure. I don't believe they would. You know, they have windows that open to the air. So it's certainly something I guess like a lot of things, you just have to make a decision whether it's worth going. You know, if you have to go to maintain work or a job. And I think, you know, we hope our viewers are looking at is, okay, what's the the way to minimize minimize risk is the key, I think.
Yeah.
You know,
I mean,
just like anything.
It's you can't 100% say, well, I'm going to be safe because I'm doing X, Y, and Z. There's always a chance that, you know, when you're in areas with people that you haven't been in contact with previously, that you will contract it. But like you said, there are so many things you can do, you know, simple things like, you know, I got a box of these alcohol wipes, and they're great because you can carry only so many liquids on a plane and everything. You can keep a stack of these, you know, and you can I clean my phone off with these. I'm not sure if you're supposed
Phones
to do that.
get very dirty. Yeah, absolutely.
But, you know, specifically like the touch buttons, I clean my phone off several times a day, you know, specifically like the home where I'm touching, you know, your keys, like all those different, we call them fomites, but different things. So basically, if somebody sneezes or coughs, there's a projection of the droplets, and then they just kind of fall down. And you know, when people are at home and stuff, say they're holding their keys and they cough or they touch the keys. So, you know, there's potential for you touching something that somebody else touched and then touching your face. So if we could avoid people, you know, in our general area within 6 feet of coughing or sneezing on us, or, you know, singing loudly, or anything that's going to generate those droplets or aerosols, and really not touch your face, then I think we could really reduce the infection rate. And then I don't know if you remember, like a while ago, a lot of young people used to do like the floor is lava, where you have to like jump onto something really quickly. It's I don't know if it was on Facebook or TikTok. It was pretty funny. It was a pretty funny video. So I just think of like my hands are lava. Like I'm not going to touch my face with my lava hands, or like, you know, however you want to think about it. Like
that's a great way to think about it. Yeah.
Goo on my hands or something. And so every time you're like, oh, and it really stops you. Like I think about, you know, if you're doing something gross in life and you have gross stuff on your hands that you can visibly see, you're not going to touch your face. When you don't see it, you think your hands are, your mind thinks, oh, my hands are clean. Well, they're not. I mean, we have bacteria coating our whole bodies. That's just our normal way of life. There are, you know, more bacterial cells in our body than human cells. And it's a symbiotic relationship, and even on our skin. So the problem is when that bacteria gets into an area, or a virus, when it gets into an area where it shouldn't. So like you inhale it, or you get a cut and you get the bacteria in it. So, you know, the skin is a barrier for a reason, but I think just really not touching your face. It's crazy how many times you touch your face, even when you like try to think, okay, don't touch your face. So a really good thing to do is to, you know, put like paint or something on your hands and just try to like sit there for 10, 15 minutes and do nothing. Like, so not like you're trying to drink or eat, but just sit there, and you will inevitably have paint on your face when you're done the 15 minutes because you have a scratch or an itch or something, you know? So.
Yeah.
All right, I'll get some paint. We'll try it.
Wonder how many times a day we touch our face. You'll have to count. You'll have to count.
20 seconds. And remember with the Purell too, instead of people just do this and they go like this, like really like get the fingertips, get your thumbs, do the same thing as if when you're washing your hands, like all those specific areas, you know, clean inside the fingertips specifically, because that's where you touch things with your thumb, the backs. I think you need to use a good amount, enough where they feel it all over their hands. Oh, I'm sorry, not Purell, hand sanitizer. Doesn't have to be Purell, any brand.
Yeah.
Any brand.
With,
it's supposed to be specifically, I believe it's 70%. It might be 60%. I'm not sure about that, but I usually go for something that says 70% alcohol. That usually is what the standard is for the.
And is it proper that you should rub it until it evaporates and it's completely dry? Is that the guidance?
Yeah. I mean, it's always better, honestly, if you can wash your hands. Yes, this is good when you're out and traveling and everything, but if you could wash your hands, because people are more systematic when it comes to washing their hands. So when they do Purell, they kind of like this, and they're like, okay, I'm clean. When you wash your hands, you're thinking about, oh, my hands are dirty, and you're doing the motions that Dr. John we watched talks about of washing the back of your hands. He's another great nursing clinical instructor. He's a PhD, I think.
It's out of England.
Out of England, yeah, Dr. John. He's amazing. He comes out with new content every day, and he's been doing it since the beginning of the pandemic. And he really talks about hand hygiene. That's like his big thing. And he talks about just, simple things like vitamin D and, staying healthy and the things that we should be doing, the things that I feel like aren't focused on the news, but things that we can do in our everyday life to potentially, reduce our chances and
That's good
stay
advice.
healthy.
Well, we can put that link onto the.
Yeah, we'll link to Dr. John, definitely.
He's great. He's great. Yeah.
Awesome. Well, Sondra, this has been an incredible conversation and very informative. Thank you for joining us.
Thanks for having me,
Yeah,
Mo.
thank you.
Absolutely. And as always, if you like what you see, make sure that you subscribe, you hit that like button, and somewhere there's a bell. Jeremy, where's that bell? There it is.
The bell's up here. Is it up here?
No, it's on the bottom.
Is it on the bottom?
It's on the button somewhere.
It's a bell somewhere. People have been asking me about the bell, so.
Ring that bell so you're always notified when we post a new video, and we'll see you guys on the next one. Bye-bye.
Take care, guys.
Bye, Mo.